I've been getting a lot of questions lately about the three-piece penile implant on my website, so I thought I'd share some of the questions and the answers with you. So the first question, and probably one of the most hot topics in the implant world, is does it make my penis longer? And the easy answer is no. So what you have now in terms of a stretch penile length is what we can predict you will look like after the implant goes in the fully erect state. These implants were never designed to give you a longer penis. However, they can give you a girthier penis. So both implants will do that for you. Second sort of runner up to that question is, how does it feel? How does it feel for myself with the implant, and how does it feel for my partner? So for the patient who has an implant, they'll tell you that it essentially feels like it used to feel when they had a rigid, rock-hard erection. Because we don't alter any nerves, we don't alter any of the anatomy in your penis. We're just basically placing an implant within the spaces that already exist in your penis. So the nerves are unaffected. So essentially the glands in the shaft feel just the same or better than they used to when you weren't having good erections. And then in terms of partner satisfaction, we've actually done studies on both patient and partner satisfaction rates with a penile implant, and they're about 95 to 98% for both patient and partner satisfaction. One funny one that I think is pretty interesting, patients ask quite often, is when I'm going through my airport, does the metal detector go off? Absolutely not. These are, there's no metal components within here that will trigger an alarm at an airport, so nobody's going to figure that one out. How long do they last? They last between 12 to 15 years. We just had a patient come in with an implant that lasted more than 20 years, but I'd say on average it's about 12 to 15 years per patient. And it depends on the use. The more you use it, the quicker it's going to wear out. What happens, however, so a follow-up to that question is, what happens when my implant breaks or it just stops working? And the answer to that is we take it out, and at the same time we'll put a new implant in. We do wash out the spaces where the old implant was, because there's something called biofilm that deposits there, and that can harbor some bacteria. So put you at a slightly increased risk for infection, but with a significant washout, that infection risk is very low. A follow-up to that is, what happens if my implant gets infected, then what? So that's a more risky type of procedure. We remove the implant, and at the time of that procedure decide whether another implant should be placed at that time, or the infected penis is washed out and then implanted at another further up follow-up date. I think overall the satisfaction and results with the penile implants are very high, and this would be a great option for many, many men. Very important in sort of these question-answer scenarios is I really recommend, if you're strongly considering having a penile implant surgery, that you go to someone who is a high-volume penile implant surgeon. There's only about 7% of urologists that perform these procedures, and of those, there's only a handful of high-volume implant surgeons. And it's important because, just like any plastic surgery procedure, you want the best outcomes, and you will receive the best outcomes from someone like me and other high-volume surgeons.